So my name is Dr. Stewart Mottram, and I'm delighted to introduce you to the first of tonight's projects, English Literature, Water, Health and Wellbeing in Estuary Communities, 1500 to 1700. So let's first of all take a look at the supervisory team for this project. So continuing what Bryony was saying in her talk about the interdisciplinary ambition of the centre, the supervisors for this project cross the disciplines of English literature and healthcare, but share interests and expertise in the relationship between watery environments, health and well-being. So in her research, the second supervisor, Amanda Lee, looks at how health and well-being is related to where you live. Her research focuses on the present day, but she also has academic interests in the history of disease and disease transmission in estuary areas. And my own research focuses on the 17th century and explores relationships between well-known writers like Shakespeare, Milton, and the Hull poet Andrew Marvell, and the estuaries, so London, Hull, in which they lived and wrote. I'm particularly interested in how writers represent the experience of living with water in estuary communities. So I'm interested in literature about flooding and about historical disease conditions like malaria that were common in estuary communities. So moving on to the next slide and how these interests relate to the project. So the project combines mine and Amanda Lee's interests in the geographies of disease, focusing on water in the 17th century as a spur to health and also a source of disease. And looking at how this relationship between water, health and well-being is reflected in a broad range of writers writing in or near a whole range of estuary communities in the early modern period. The project will use English literature as a source for discovering more about how water was managed in this period, including how towns supplied clean water to their inhabitants. And it will reconstruct patterns of historical epidemics to find out more about the role of water as a transmitter of disease. And finally, the project will ask how findings from the past can help estuary communities learn resilience in the face of climate-driven water challenges today. So that's a brief introduction to the project. I'm very happy to hear from you if you'd like to learn anything more about the project.